Hello, everyone, and welcome to another episode of Random Health-ish. I am your host, Dr. Gloria Stone-Ozbek, and tonight we have a very special guest. We have Shana Scott with us, and she's going to be talking to us about health policy and compliance. So please join me in welcoming Ms. Shana Scott.
Hi,
Hello,
good
welcome to
evening.
the show.
Hi, Dr. Gloria. How are you?
I'm doing well. I'm so excited to have you on the show tonight. So first, just start off by telling us a little bit about who you are and what you do.
All right. Yes, I'm excited to be here as well. I'm Shana Scott. I am a compliance professional. I'm a compliance officer for a healthcare company. I have been in that space for a little over a year now, and I'm a policy professional. I am an assistant professor of health policy at a school here in Georgia, at University of Georgia. And so I've been a policy professional, with a JD MPH for the last 7 to 10 years. And I love all things policy, all things health policy, all things healthcare. And so compliance, a lot of people don't know compliance is a part of policy. It's a part of the legal space. You get either a legal training or a policy training, and you can work in compliance. And that means you are a rule follower. So you do all things rules, all things policies, all things regulations. And so that's what I do from a healthcare perspective.
That is awesome. So tell us a little bit about your background. Like, where did you go to school and how did you get into health policy?
Sure. So I went to a lot of schools. So I went to Morgan State, so the Morgan State University in Baltimore, Maryland, where I got my undergrad degree in biology. And then while at Morgan, I got interested in public health. And so I went to Armstrong Atlantic. It's a school down here in Georgia. It's now Georgia Southern. I went to Georgia Southern for my master's degree in public health. And it was in that space during that time that I really became interested in policy because I wanted to work on, we hear about health disparities and, those conditions and those systems that, cause minorities or people of color to experience certain things more than others. And so for me, I wanted to look at that from a legal and policy perspective. So like, what are those laws and policies and systems that are in place that keep us or prevent us from achieving optimal health? And so for me, that meant getting a law degree. And so I had worked in public health policy for years at the local level in Georgia. And I decided to go to law school 7 years after working in public health to really understand like how laws play a role in that space. And so I went to Loyola University Chicago School of Law in Loyola, and I focused on health law because there's no real like public health law major. And so I focused on health law with a focus on compliance and public health to look at the intersection of law and policy.
Wow,
A lot of stuff.
But you know what? That is so impressive because you don't meet too many people that have a passion about healthcare and also are able to, get a law degree as well. So that speaks volumes, I think, about, just your dedication to the field.
Thank you. And, it wasn't an easy thing. I laid it all out, but, law school's no cakewalk. It's a process. And so for me, I knew what my end goal was and what I wanted to focus on. And it's really that, how are laws and policies putting us or how are the system? Because like it's the law is a system. So how are these systems really preventing us from reaching optimal health over and over again?
Yes. So for those watching who aren't really sure exactly what policy is, what that consists of, can you tell us exactly what health policy and compliance entails?
Yeah, it can really run the gamut. It can be as simple as like an organizational internal policy where you are drafting policies around attendance and time and HIPAA, like, right, that's probably one that a lot of people are familiar with. When you go to the doctor, you have to sign off that HIPAA clearance. So HIPAA is one that all healthcare entities have to deal with on a day-to-day basis. And so they may have like their own internal processes that they follow, but HIPAA comes from the federal government. It's the Health Insurance Portability Prevention Act, which pretty much says that you can take your insurance from place to place. That's really what it entails. And it's privacy rules around it. So entity can't sell your information, can't sell your name, your social, etc. And they are known as covered entities. And so a covered entity is just prevented or prohibited from doing certain things, and they just have to keep your information private. So it can be as simple as that, or as complicated as the ACA, the Affordable Care Act. We're all familiar with the ACA under President Obama's administration, where this law, a lot of people, again, know the ACA from an insurance perspective, right? But the ACA is much more than that. It talks about public health. It talks about disability rights. So there are a lot of sections within the ACA, and people who work in policy, their job is to either write those acts or those laws, or their job is to interpret it. And you can work in policy at the local level, which I've done. You can work in policy at the state level, which I've done, or you can work in policy at the federal level. And the work that you do will differ depending on the space that you are in, as well as the level of engagement that you that your state or county needs you to have.
Okay.
Or you can be in-house, which I'm also in-house now. So it's and in-house means that you're in a private entity and you're not like with the government or with a, like a law firm or something like that.
And it also entails, like, for instance, if you were in a hospital setting, just everything from the emergency protocols. A big thing would be the COVID-19 protocols, like whether or not you have to wear a mask when you walk into the facility. All of this stuff is included in the health policy and compliance. So
right,
just make sure everyone is safe in the facility.
Yeah, so even thinking about that, like something that people may be familiar with, COVID, right? You may have a rule that says, masks are required when you enter this facility. Some people may be enforcing it and some people aren't. And so you can have an internal policy that says that you're going to mandate that says that you're going to have these requirements. In my organization, when we were returning to work, I drafted a COVID return to work pandemic operations policy, and it has everything for as simple as, wearing masks. Masks are mandated at work, to as complicated as what are the clean-in procedures that we are going to have? What are the return to work requirements? Let's say if Dr. Gloria had got COVID and she came to work, how are we informing people about that to keep them safe? Because that's privacy. And so you can't just say, well, you were in contact with Dr. Gloria, I can't ever give your name out. So like, what are the processes that you're going to put in place so that we are keeping Dr. Gloria's information private, but also keeping you as an employee safe? So all of that is a part of the legal compliance process as well.
Yes. So what do you think are like some of the common misconceptions about health policy and compliance?
I think one misconception about health policy is, well, I guess, are we looking at it from like a student perspective or a regular community person perspective? Because it can differ.
Well, let's do both.
Okay. So from a student perspective, I think a lot of students who have their MPH, they're not really sure of how to start or where to begin. And they may think that you must go to law school to get into policy. And so that's not true. You don't necessarily have to go to law school. It is advantageous depending on what you want to do and the type of work that you plan on doing, but it's not totally required. From a community member perspective, I think, people don't want the government up in their business, right? They don't
Yes.
want the government telling them what to do and how to function in every single capacity and every single way of life. And so that is that's probably a barrier for a lot of things when it comes to how we choose to live our lives, because there are just certain things that we want to be able to have some sort of regulatory force behind, and people don't want the government all up in their ish, as the name of
Yes,
your
definitely.
show.
I know one of the biggest challenges right now is that, when you go to the hospital, and you have a family member there, they're only allowing one person with that family member at a time.
Right.
So is this something that you guys have kind of implemented in your facility as well? Like, is it limited as the number of people that you can bring in with you to your appointments, or how does
So
that work?
we don't, the place that I work, we don't, it's not an inpatient facility. So we typically get access to patients once they've been discharged from the hospital. And then we may take care of their in-home care, or if they need oxygen or infusion, if they have, so it's more out of the health
Okay.
system. So we don't have to deal with that. But that is, so that came about because of OSHA. So OSHA has during the beginning of the pandemic, and OSHA is the Occupational Safety and Health Administration, and OSHA put out certain guidelines for healthcare facilities, how they should function during the pandemic. And so it's a requirement for hospitals to function under these requirements as a result, just for safety purpose and regulatory purposes,
Okay.
because we don't want to then, cause a continued communicable spread in the community if people are now coming to the health system, seeing individuals who may be diagnosed with COVID, or even are not diagnosed with COVID, but then inadvertently become infected and then bring it back out into community.
Yes. What do you think would be some red flags for a patient if they walk into a facility and they don't have this X, whatever X is? Like, what would be some red flags that they probably should choose another facility, that their
Okay.
information is probably not as protected as they would hope for it to be?
Gosh, I would say now in, 2021, where there are so many regulations and so many rules, like no place should really, like, especially a hospital system, right? You should not like really have any red flags. But let's say maybe like a home care, or like a hospice, or some sort of facility where you need temporary care or something for the elderly. So if they don't have their licenses up and posted, if you don't see that information when you walk in, to see when they had their last inspection, to see when their license was last renewed, so you should be able to see. So let's say it's like a home health facility, and they are accredited by JACO. Let's just use JACO, the Joint Commission, as one example. JACO will come and do a site visit probably every 3 years, every 4 years, something like that. That license, that accreditation, that certificate should be posted right when you walk in. Sort of like when you go to a restaurant, a fast food place, and you see that score like right there at the
Yes.
window. They should have that posted to say that they passed in 2019 and 2020,
Mhm.
whatever. And so if they don't have that, that's a red flag. Or let's say they have it, and it looks like they might have not been reaccredited. That's a red flag. So I think that's one of the most immediate red flags that you could look out for. Or let's say just now with COVID, if you show up and they're not modeling good public health practices,
Mhm.
i.e., they don't have masks, they don't have signage that says like a mask is required, I'm gonna exit stage left, because if their employees aren't even following the basic public health guidelines that are being put out there, then you know that they're not following a lot of other things.
Yes. And I know even for us, we have to post our license at all times. When
Exactly.
we get an x-ray machine, we have to post that it has been,
Been
inspected
serviced.
and
Exactly.
serviced and all that good
Yes.
stuff, just to make sure that everything is in compliance. And a lot of people
Mhm.
don't even really realize that when they come to see the doctor. They just are thinking about whatever condition or symptoms that
Mhm.
they're having. They don't really think about all the extra stuff behind the scenes that goes along with that.
Yeah, because machines have to work, they have to be
Mhm.
checked, they have to be up to par. The people who are doing the service for you, whether it's an ultrasound or a breast
Mhm.
exam, they need to also be trained on how to use the
Yeah.
machines as well. And so, if they don't have the credentials, then in healthcare, I would say credentials matter, right? Letters behind your name matter, certifications matter. Um, and if they're missing, I'm going to be less inclined to use you.
Yep. And their machines have to be calibrated as well, you guys.
Yes.
Which means that
That's
they
not
have
my
been.
space, but
Yes.
it's still important. Inspections matter. Passing inspections matter. Like when you go to a fast food restaurant, and if they have like an 89, you're like, I'm not. Yeah, it's the same for your healthcare facility. Look up their last grade and see what they got. That's important.
Yes. What are some of the things that you want the general public to know about your profession?
Okay. So I will say, something we know that the Biden administration, it's been what? Oh, it's been a month. It's been 30 days since inauguration, right? And so there have been a lot of talk about the executive orders. And a lot of people might not know what's going on. And so I would say just, try to stay on the pulse of some of what's going on. I know it's a lot of news outlets and not a lot of Facebook lawyers out there right now,
And
because
doctors?
Facebook lawyers and doctors and Dr. Fauci's assistants and all of that. But I think, getting your news from one or two credible places like a NPR or a New York Times or a Washington Post, just to see what the daily headlines are, what the focus is, and then really also try to keep up with what's happening locally in your community from a policy perspective. While everything that's happening on the federal is great, understanding what's happening in your local community is also important. Locally, we know that the COVID vaccine is a big thing that's happening right now, and people may or may not be able to access the vaccine or may not understand why they can't get the vaccine right now. So I think, being basically informed in that manner by just going to your local news source or your state public health department website to get the most up to date information, um, is probably, I would say that that's like the first thing I would do to understand what's happening right now.
Yeah, I think that's really good advice. During our strategy call, you mentioned something about the Federal Register. You
Okay.
were telling me something about you can look something up. I can't remember exactly what was that. What was it that you said that we can look up to check and see what's going on?
Yeah, so I wouldn't send like a regular everyday person to the Federal Register, because it's a little complicated. But the Federal Register is where, so it's a website. Back in the day, it used to be a paper document, and you can go to your local library and pull like this week's Federal Register. But it's a website that you can go to get up to date information from the Office of the Inspector General. And so they put out advisory opinions related to anything. So let's say if your facility, Dr. Gloria, had a question about payment, like, can I give out gift cards to try to convince people to come and get chiropractic services, right? You might have that question. You might want to do that. Um,
Some people
and
do
so,
that.
but it's against the law.
I
And
know.
so, the Federal Register is the best place to figure out, is that okay? So you could go to the Federal Register and search and see, like, is it okay for like this type of facility to give out gift cards to patients, and it has that answer. Or you can send them a letter asking if it's okay, and then they'll respond to your letter. Usually what they do in the advisory opinion, they will already say like, this opinion is already there, or they might then investigate you and decide to fine you. And then in that process, they'll say like, well, Dr. Gloria's clinic did this, and here's the scenario, and here's how much they were fined, and here's why you should never try to do this. So
Wow.
the Federal Register is one place to go just to get up to date information about certain things. But again, I would not like send the regular average person to the Federal Register to look up information. All of that, you can go to the Hill. That's a website that every hour, every 30 minutes is updated on policy actions that's happening in DC. So I would use the Hill as like a regular everyday person and not the Federal Register.
Okay.
And the Hill like Capitol Hill, so like the HILL. And I don't know if it's .org or .gov, but you can, if you Google the Hill, it will come up.
Okay. Well, that's helpful information because
yeah, don't go to the Federal Register.
Yeah. A lot of people, when they start reading that stuff, they're like, what does this mean? Like, I have no idea what this means. I know recently my friend asked me because, people are starting to give their employees incentives if they get the COVID vaccine. And so she was like, is that legal? Can they do that? But I looked it up and it is legal. It is legal for them to do that. And I just thought that was so crazy. Like, to me, it's like, you're going to pay
That's just
me.
going to open a can of worms. I'm not, so, it's a new space, right? So there's nothing out there that we can say like, this is legal, this isn't legal, because like COVID is a year in, right? For the United States, at least. So, everything is sort of fair game right now, and people are testing the waters, and everyone is doing something for the first time, and we'll see. I think the federal government is staying silent on certain things and just letting it play out as it is playing
Yes,
out.
and I found it actually under the EEOC website, and also they have to, I think, be in compliance with the American Disability Act. Because
So
because
it's not saying that it's legal on the
right.
EEOC website, right? So what it's saying on the EEOC website is that it's not illegal. What you must do is make sure that you are not in violation with the Americans with Disabilities Act, which pretty much says that well, it's weird that it's coming up with the payments, because what I know this to be coming up with is the question came up about whether employers can mandate the vaccine for their employees. And so that is where the EEOC has put in a response saying, no, it's not illegal to mandate the vaccine, but if you are going to mandate the vaccine, know that there are exemptions out there, and you must comply with the exemptions as per the Americans with Disabilities Act. But it doesn't necessarily mean that the EEOC has explicitly stated that you can mandate the vaccine.
Yes.
Yeah. So I'm not sure about the payment piece, because I hadn't really looked that up. I was
it was something about, it had to be, I think, under a certain percentage. Like, I don't know.
Okay, I'll check into that, because it hasn't. I haven't looked it up, and what I do know from that ADA, Americans with Disabilities Act portion, is that employers were asking if they could mandate the vaccine.
Yes, because I've really been hearing people, they're getting threatened, and they're saying that they'll fire them if they don't get it, or they'll ask them to, like, and I'm like, how can they do that? Like, it's not even FDA approved yet. It's still under the, emergency use authorization use.
Right.
So,
Right.
I just thought that was so crazy.
Yeah. I think that employers that are teetering that line and considering letting people go if they don't get the vaccine, they are walking a fine line to some EEOC claims, like a
Lawsuit.
fine line, meaning that they're gonna fall over the edge because
Exactly.
because the federal government has remained silent, but it has also, a lot of lawyers have already been talking about this, and we know where the line is. And if they don't have a compliance person or a legal department in their company to really advise them of the line that they are towing, they're
Mhm.
going to be
In
they're
big
going to have some
trouble.
lawsuits on their hands. Yes.
Oh my goodness. So, yeah, so that's a lot to take in. So, if you are experiencing that in your workplace, make
Do not call
sure,
me. No, I'm just joking.
or you might
No,
want
I would say that they should contact their HR department. HR will have everything that they need to know. They should have everything that they need to know. Because I do want to, I guess, maybe preface this entire conversation with, none of this is legal advice. So do not consider any
right.
of this legal advice. Um, I'm on a podcast having a
Yes.
educational
Consult with
conversation, but this
your
is,
HR and do your
yes,
own research
exactly,
and contact an attorney if you feel that
exactly,
you are being treated unfairly.
exactly.
So,
None of this constitutes a legal relationship between anyone that's watching this podcast and me. So let me put that out there.
I
I
was
don't want
joking.
anybody messaging you like, that girl
I
said
know.
I can sue. No, I
I
didn't say
know.
that.
Well, Dr. Osbeck said no, no.
No,
Okay, so let's move on. So you also work with nonprofits.
I
So tell
do.
me a little bit about that.
Yeah. So outside of, my 9 to 5, you know how we are. And last year, all the memes said that we needed to have a side hustle because COVID. But no, I was hustling before COVID. Um, but I really like went into full force last year. But my business outside of my compliance work is consult with Shana. So you can consult with me, but just not for legal matters. And I am in the space of strategic planning, business development, and grants management. And so if you are, a small to medium to large business, and you are looking to work on a strategic plan or a strategic process or leadership development, leadership coaching, or if, you have a business and you are trying to figure out, well, how do I generate more business for my company? How do I get into this space? How do I get into grant writing or government contracting? How do I get a piece of the pie? I assist with that. I do grant writing, find the projects for you, find the RFPs, and assist with writing the grants, responding to the RFPs, getting you set up to do business with local, federal, state governments, et cetera, or other businesses out there that might put out an RFP. And an RFP, for those who don't know, is a request for proposal, meaning that that's a way that an entity can put out information for a project that they want to work on, and then someone, a business, LLC, can respond to that with their expertise, with their scope of work, what they can do, and then be funded by that organization to do that work. So I do that outside of my main compliance work in my consulting business.
Yes, and I'm actually going to be working with Shauna.
Yes. Yes, yes. I need to get it together.
Yes, I'm trying to get all my stuff together now, and we're gonna have our first board meeting next month
Okay.
coming up.
Okay.
So, just to start putting things into place so we can get the ball rolling. So I am really excited about that. And
Yeah, and I on my website you'll see this if folks are able to get to my website. On March 18th, I am doing a grant, just a basic grant writing class, an intro to
Mhm.
grant writing. So not showing how to write grant, but answering some of the basic questions like, what is an RFP? How do I get started with the process? So I'm doing that in March, and the information is on my website of how to register and all of that.
Okay, that's gonna be awesome because I know quite a few people that are in my circle that have nonprofits and have been really getting the ball rolling with their nonprofits during this time as well. So
Okay. Yeah, so
if
I'm here
you
to
send
help.
me
I'm
the
here to answer
information,
questions. Yes.
yeah, send me the information and I'll make sure to
Okay.
post it on the
Okay.
Facebook page too.
Okay. Awesome. I'll do that.
Yeah. Do you have any closing remarks for our viewers out there?
Yeah, I know it was a lot of information. I know policy can be intimidating, but know that there are people out here that are really trying to demystify that process for the regular everyday public. I don't want my friends or people I know to go out there reading the Federal Register. I don't want them trying to figure that out because it's complicated, right? Like, imagine when CDC was saying, wear a mask, don't wear a mask, now it's wear 2 masks. That information can just be a little overwhelming to try to go to the CDC website and figure everything out. So know that there are regular, everyday people like me that are trained to do this, and we want to make it as plain for you as possible. We want to articulate it in everyday language. And look, I have 100 things that I'm doing, but I also have a podcast. I'll send this to you as well, called The
Yes.
Policy Memo. And so we talk policy. And it's 3 of us, myself and 2 other ladies. And these few episodes that we have coming up, we're talking about the Biden-Harris administration and just everything that they're talking about from a policy perspective. And we're just breaking it down in everyday girlfriend chit chat. What does this mean? How does this impact you, and what you can do?
That is so awesome. I'm so excited for you.
Thank you.
Well, thank you so much for blessing us with your presence on the show tonight.
Thank you
I'm
for
very
having me.
grateful. Yes. So I want you to hang tight. I'm going
Okay.
to do some closing remarks really quickly.
Okay.
And so hold on one second. All right, guys. So, for those of you out there watching, be sure to tune in to Random Health Ish every Monday at 7 p.m. and that's Central Standard Time. We stream live on YouTube as well as Facebook. So, be sure to like, subscribe, and share this video because we would love to educate as many people as we can on various healthcare issues that are going on in the general public. So, the next thing I would like to discuss with you guys is if you have not written down this website address to contact Shana, her website is www.consultwithshana, and Shana is spelled SHANA.com. Okay, so if you ever want to reach out to her about her nonprofit and the different things that fall under that umbrella, be sure to check her out and reach out to her. You will not regret it. She is a beast. So thank you so much for tuning in, and we will see you guys next week. Have a blessed evening.